Hi, I'm Dr. Jenny Hargrove, emergency medicine doctor at San Juan Regional Medical Center. The social distancing guidelines that are set in place are really one of the most important things that you as a community can do to prevent the spread of this disease. It is really one of the only things that has been shown to reliably work in getting this virus under control. Really, as a community, you guys are on the front lines. As an ER doctor and a quote frontline worker, we're really just on the back lines picking up the pieces. This is in your hands. Social distancing works, staying 6 feet or greater apart, wearing a mask correctly over your nose and your mouth, not touching your face, hand washing, hand sanitizer. These things do work. So the question of this being an individual right not to have to wear a mask is a moot point to me. Just like we all have a right not to breathe secondhand smoke, in the smoker that is insisting it is his right to smoke wherever he wants, we all as a community have a right not to be exposed to people that may be asymptomatic carriers. I saw a meme recently that said, no shirt, no shoes, no service. That's never been a problem. I don't understand the problem with no mask, no service. So as community members, it's important to be aware that you can now be a shedder of the virus prior to having any symptoms. In fact, there's evidence out there that shows viral shedding may occur most in 2+ days prior to having any symptoms. In addition, some people have minimal to no symptoms with infection, and so they may never be aware that they even had the disease. Others may have no symptoms, again, for the 2+ prior days prior to having symptoms. And this is why it's incredibly important that even though you don't have symptoms, you need to wear a mask. Some will argue it doesn't protect them. There's still a lot that needs to be determined about what a mask does protect. However, we do know there is some protection from others when you wear a mask. So even if you don't have symptoms, please wear a mask and protect others. This has been a dark time for all of us as a community, and we need to remember to be in it together. And there is hope. There is so much that you can do, starting each day with doing your part, being an example to the community, showing up in the grocery store with your mask on, carrying hand sanitizer, openly showing that you are doing your part, standing up for the grocery store worker when others choose not to social distance, encouraging others to do their part in social isolation and all these other precautions. In addition, this has affected all the healthcare workers. We have all had friends and family that have been affected, and we want it to end as much as anyone else. I've watched little grandmothers die alone, not being able to be surrounded by their families and their loved ones. This is a painful time for so many people and a painful time for loss. And the more we do our part, the more we can prevent our loved ones from dying from this as well. Unfortunately, there's been a lot of misunderstanding in the community, especially among healthy members of the community, thinking, oh, this is just the flu, another viral illness. This is not the flu. These patients get sick and quickly. There's a very distinctive pattern on chest x-ray and CAT scan. This virus takes over the lungs and fills them with fluid, and people literally drown to death. And it's an awful way to go. They go downhill very quickly. Yes, there are members of the community, the elderly, the pre-existing medical conditions that are far more predisposed to this. And I have seen perfectly healthy individuals need to be admitted on oxygen to the hospital for support before they recover from this. Don't be fooled that you can't be one of them. The frontline heroes in all of this are you. Social isolation works, hand washing works, wearing a mask correctly all work. This is the main way that you can help prevent the spread of this disease. And once and for all, let's all be kind to each other. We're all in this together.